Welcome, everyone. Thank you so much for joining us today. Our platform is letting everyone in, so we're going to give it just a minute here while it's allowing you all in. But feel free to hop in the chat, give us a greeting, let us know where you're tuning in from today. We would love to hear from you, and we'll be started shortly. Welcome, welcome. Thank you all for joining us. For those that are just coming in, we're just holding off a minute here while our platform is letting you all through. Please feel free to go in the chat and let us know where you're tuning in from today. I see lots of greetings coming in, so welcome everyone. We are so excited to have you with us today. Wonderful. Well, we have a lot of information to get in your hands today, so we are just going to kick it off. Welcome, everyone. Thank you for joining us, and welcome to today's webinar, Creating a Culture of Support and Wellbeing, Introduction to MHA's Workplace Mental Health Toolkit, featuring our guest, Walgreens, today. I have just a few notes for you all before I introduce our panelists. This webinar is being recorded and will be emailed out to all registrants within the week. We currently do not offer CEUs, but if you would like a certificate of attendance, you'll be able to request one of those. I'll be pasting that link in the chat that you can follow to fill out that form here shortly, and that'll also be included in your follow-up materials. We might have some time at the end of today's presentation for some Q&A with both Holly and Taylor. So if you have any questions throughout the presentation, feel free to use the chat. We'll be collecting those and then going through some of them at the end as time allows. Which leads me to our wonderful speakers for today. I am so honored to introduce Taylor Adams and Holly May. Taylor Adams superheads MHA's efforts on its Bell Seal for Workplace Mental Health National Employer Recognition Program and its annual Mind the Workplace reports. Her previous work was focused on suicide prevention, and she brings this experience to support companies in evaluating and refining policies to support staff in their mental health journeys. Welcome, Taylor. We also have with us today Holly May, who is responsible for the strategy and direction of innovative global HR programs, policies, and practices that support WBA's business goals and initiatives, and for ensuring fair and equitable treatment for all team members. She also leads environmental, social, and governance, and serves on the board of Shield Health Solutions, in which WBA is a majority investor. Welcome, Holly and Taylor. We are so excited that you are both here with us today to share more about this new workplace resource that you all have created and put out, and to hear about what Walgreens has been focusing on surrounding workplace mental health. So I will let you two take it away, and welcome.
All right, so first off, we're going to start with an overview of what the toolkit includes, because it is quite a lengthy document, and then turn it over to Holly, and we're going to have a conversation about how Walgreens has applied a lot of these things in their workplace. But kind of starting off here, so I'm not going to, I know the folks who are joining us today, I really appreciate you taking the time to join us, are passionate or have some, something piqued your interest about this webinar. For workplace mental health. So I wanted to ask you a question in the chat, and feel free if you're comfortable responding in the chat. But what brings you here today? What interests do you have? What about workplace mental health excites you? Just love to know a little bit more about your background and why you're joining us today. I wanted to share a little bit about why this is so important to me, and why I'm hopeful that this is a good resource for folks to use in their workplaces. I've been working since I was 17 years old, continuously. I don't remember a time when I hadn't had some type of job. I've worked in all different industries, and I started out working for a fast food restaurant at 17. It was a little bit of a miserable experience because I wasn't familiar with minor labor laws and, what my rights were as a worker. And I really struggled being a young person in the workforce where I was balancing school and having my first job and trying to pay for the small expenses that I had at the time, and felt really trapped. It had a huge impact on my mental health. It had a huge impact on my self-esteem, my sense of self-worth. There'd be times where I would go, they called it the hole, where I'd go into the back to take orders and I'd be there for 8, 9 hours a day without any breaks, without restroom breaks or lunch breaks, thinking they had like forgotten about me back there, practically in tears by the end of the day, where customers were noticing and concerned, and for good reason. Um, but at the time, on top of going to school and working and extracurriculars, getting ready to apply to college, I was doing a lot of research around labor laws and came across, realized that this particular workplace was treating them as mere suggestions, and it frankly pissed me off, realizing that I was just not being treated as a person. And I wrote like a school newspaper article about how to advocate yourself as a student worker, what rights you should be aware of, what you can ask from managers, and had the same conversation with management, how things needed to change, because this wasn't just me, this was everyone working at this location. So anyway, all that to say that when this position opened up at MHA, I didn't really put the pieces together until I came into it and learned more about this and realized how much of an impact work has on all of our lives, on the people that we live and love. It's a huge factor, and it's mostly seen as something that's a burden or something that's harmful to your mental health. And we're really hoping, especially with introducing this new toolkit, to shift that paradigm and think about workplace policies and practices that are rooted in prevention and early intervention and holistically support workers' mental health and well-being. And you'll see on here, I have one of the infographics that is part of the toolkit. I apologize that the font is very tiny, but I just wanted to show you visually what it looks like. And all of this is what you'll see on the screen, can be downloaded at mhanational.org/workplace/toolkit. You're going to see I'm going to push that a lot. If you haven't already downloaded the toolkit, I might mention that 3 or 4 more times. But with that, so with Walgreens support, which we were really excited to be able, this is the first year we've been able to do this. We developed a workplace mental health toolkit. It is a 40-page PDF, so pretty lengthy, and we tried to cover quite a few different topics, not everything, but just enough to get people started. So if you do download the toolkit, you'll have access to the full PDF, but then there's 5 sections broken down between culture and benefits that you can download each item as like an individual PDF. So you can kind of piecemeal things together and use it however you see fit. But basically, the toolkit is made up of different resources for organizational leadership, for people managers, HR professionals, people part of your benefits team or department, and workers who can be mental health advocates within their own workplaces. And I do want to stress, like, it was important to create materials for each level of an organization, because our last report that we released in April showed that it takes time, investment, intention, action from all levels of an organization to drive that change in workplace culture and create that mentally healthy work environment. So with that, and I wanted to, just as a broad look at what the toolkit, how it's made up. So it has 5 sections. Each section includes an introduction on why it was important that we included it as part of this. Each section has examples of employers that we've worked with in the past year who have implemented these things within their own workplaces. And then they all have individual materials you could download to kind of supplement that information. And I'm going to go through in the same order these 5 sections. So we started thinking about, first and foremost, supportive people management. If someone were to ask me what is one of the most important things, what should we prioritize when we're trying to build out our own workplace mental health capacities, what should we focus on first? Whether you're kind of far along in your journey and thinking about these policies or just kind of getting started. And I'm always going to point to people management, developing strong connections and relationships between manager and direct reports at all levels of that organization. Um, and with that, and it's interesting because this comes up consistently year to year. Every report we've done, it's been consistent how closely having a good managerial like relationships with an organization ties to employee or worker mental health outcomes, but often gets left out of the conversation when we talk about workplace, mental health and things like that. So this is the first thing I wanted to highlight as part of it, and the materials that we included for it. One is a 4x6 printable postcard and one side talks about 11 tips for talking to talking to an employee with a mental health concern. Oftentimes, when mental health issues arise in the workplace, the first person that someone is going to turn to is likely a peer, a colleague, and depending on the relationship, a manager. They're not going to automatically, seek out the HR process to report it or disclose something, especially if it's not, more severe or it's not really interfering with their work responsibilities, but it's still a problem or still something that's affecting their productivity or engagement. So it's really important that both workers and HR professionals and people managers understand how to have this conversation and just get comfortable with it. No one's expected to be a mental health professional unless that literally is your profession. But just having enough information so you can ask the right questions and not feel weird or uncomfortable about it. So those are those 11 tips on one side of the postcard, and we want it to be like a printable, so it's something you can include in common areas at physical work sites, in addition to sending by digital means as well. So anyone can have access to that in one way or another. On the back side, we do talk about stress and burnout. Burnout has been a huge buzzword in the last couple of years, especially during the pandemic. But I feel like there hasn't been enough conversation around what exactly that means and what the signs and symptoms of that are. Sorry, take my email down here. So what we added, we broke it down by the three signs: emotional exhaustion, reduced self-efficacy, and then cynicism. We have definitions for those three things. We have questions that you can ask your peer, your direct report, your colleague related to those three signs. And then you have potential solutions, because depending on the severity of burnout, taking time off may not always be the appropriate response. And then also the last piece of this section is we have an infographic on emotionally intelligent manager do's and don'ts. I have to say, I personally, I've recruited a team to kind of pull this together because we talk about emotional intelligence a lot, but sometimes it's hard to put that in a practical setting and like see what that looks like in interactions. So I had a lot of fun putting this particular resource together, and I encourage you to check it out. But we have 8 or 9 scenarios or interactions that are common between managers and workers. And we have, here is a emotionally intelligent way to respond to the situation. Here's a not so emotionally intelligent way to respond. And the responses may seem similar. And that's what's so interesting about applying this in the workplace. It's subtle differences in the way that you interact makes a big difference in employee health and well-being. So the second section is around developing an employee-driven mental health strategy. Just like with people management, this would be the next thing I point to, in that changing a culture, changing the way people treat each other, evolving these relationships in a workplace, creating a culture of support is going to require a strategy. It's not going to be a one-off training. It's not going to be a lunch and learn, although I do think those are important and organizations should continue to implement that. But it can't be the one solution to this issue. So when we talk about strategy, this is involving all levels, again, of the organization, workers themselves as advocates who are participating in employee resource groups or business groups. This is HR professionals or wellness coordinators who have that designated position or department as part of their organization. Leadership, it's really difficult to drive change, especially at the worker level, without some type of leader, representation, sponsorships, just support to help drive that change and get the ear of your organization's decision makers. So some of the items that are included in this section, we have sample mental health survey items, and we chose, we have about 50 questions. Do not recommend asking your workers 50 questions in a wellness survey, but depending on the topic you want to focus, choosing 2 to 3 that you want to incorporate. And it's everywhere from talking about engagement, stress, burnout, culture questions, sleep. So there's a variety to kind of choose from. And we picked these questions because in our research, they were the questions that most strongly correlated with the strongly correlated with worker mental health outcomes. Um, so we're really the drivers for that. And then also we have kind of 4 steps or 4 points to help build the foundation for mental health strategy. So if you have no idea where to begin, it's a good kind of framework to use for that. We talk a lot about diversity, equity, inclusion as part of that. And and for folks who've already been doing this for years, there's a lot of overlap and parallel between your DEI and B efforts and your mental health efforts. So it's good to think about those in tandem. Um, and then finally, and what you see on the screen here is, so this is all from our the employers that participate in our Bell Seal program. We identified 6 common changes that were made to either policy or program in response to what workers said in a wellness survey, or listening sessions, or whatever tool you use to kind of measure your workforce's well-being. So if you want to see examples that have in the real world, that's the resource for you there. And that's something we hope to continue year after year. It's just as we learn more about what organizations are doing and be able to share that widely. Sorry, losing my place here a little bit. And then kind of the last piece of this culture section before moving on to benefits. So promoting mental health in the workplace, and also this is paired with building a mental health employee resource group, but it is focused mostly on raising awareness. So with that, a lot of these things are building a plan on how to raise awareness, but the first thing listed here, building the case for workplace mental health, we drafted a case statement, case for support, like a 1-page letter that you can copy and paste and edit as needed and put your organization's information. And this is to help build that case to leaders. So one of the biggest obstacles that I hear from folks who are very passionate about this and want to drive that change come up against issues when leadership don't see it as a priority. We're seeing that shift a lot within organizations, but still I would wager to say that most of them aren't prioritizing their worker well-being. So this just helps build the case, and it takes the human approach of why this is important, but also that business case and business side of things of like, this is how much not focusing on this issue is costing your workplace. It includes an ask whether you're looking for some type of sponsorship for an employee resource group or just some extra time allocated to dedicate to these activities. Because in the end, people who are advocating for this change in the workplace are doing their organization a favor by helping to improve that culture and helping improve rates of engagement and getting people part of this conversation. And then the other materials we have as part of that. So we have it doesn't look like a calendar, but essentially that's what it is. We have all 12 months of 2023 with the individual mental health observances listed, and there is 1 to 2 to 3 things for every month. So if you are kind of trying to put a plan together and how you want to raise awareness, this is a great way, just a great little template to follow. And for every month or every event, we did link to resources or information on MHA's website to make it as easy as possible to plug things in where needed. And we include things like BIPOC Mental Health Month in July. We talk about Suicide Prevention Month. It covers a wide spectrum of different observances there. The next resource that we included, the 12 tips for planning a wellness event, that probably applies more to small or medium-sized organizations. But if you are planning, especially if you're going back in person or you have to think about your events in a hybrid sense, here's some just ways that you can do that. We included an internal email template. It was created for the intention of sharing it with your staff internally, but you can adapt this to a newsletter. It's purely just language that you can copy and paste to help spread awareness. And it doesn't just have to be in the month of May for May's Mental Health Month. You can use this any time of the year. It's very basic language for that. And then the last 2 things is a printable 11x17 poster and then another 4x6 postcard. And both include QR codes and links to MHA screening, which on our, if you go to the link, it takes you to 10 scientifically validated mental health screenings. And the messaging that we used is around, is it stress and burnout or is it anxiety and depression? Because sometimes those signs are really similar. So if people are concerned about their mental health, they can go and take a screening for that. It was important that those were also printable and not just shared, digitally, because this is something that if you host a wellness event and there's someone who's like, oh yeah, this would be a great thing for like my son or daughter, and they can take one home and just take a free anonymous confidential screening in the comfort of their home, because it is weird for people to do that in a workplace. And then you'll see here on the backside of that postcard, it doesn't have that yellow text in there. I just added that to the slide, but we left that space there in addition to having the crisis text line and then 988 suicide prevention lifeline. So you can download it and then edit as a PDF and include any of the resources that your organization offers. So an employee assistance program, an upcoming event, whatever that looks like for you, there's space that you can add that to send to employees as well. I want to drop my second question for you all in the chat. And we haven't covered everything yet, but just based on your experience and what's important to you, what topics would you like to see covered in future toolkits? Like I said, this was more culture and benefits, but if there's something that you really would be excited to see, please add that in the chat. Love to know. I definitely go back and, we save a transcript of the chat and I go back and take that feedback and making sure we incorporate that into future things. So drop that in the chat. So then this second part of this, so benefits, it has two sections here. First part is providing and educating employees about benefits that support mental health. I love, love, love. It doesn't matter where people are in the spectrum. This first item, 19 questions to ask your benefits broker or employee assistance program, is one of my favorites. It is kind of like it's a numbered checklist. It does gear more towards how to support workers who have a mental health or substance use condition, but it doesn't hurt to be asking these questions because it benefits everybody who deserves, a psychologically safe workplace, deserves access to good mental health care and things like that. The second checklist is how to introduce mental health during a new hire orientation. So this is definitely geared more towards HR professionals who may work in a larger organization that does a lot of hiring. But what are some of the ways that you can just incorporate this into things you're already doing? Like you already cover benefits. This is a way to call out mental health benefits in particular and different things like that. And then we have two more internal email templates. So just language that you can use to help educate your internal staff or have as part of a newsletter. The first one is just how to educate employees about benefits that support mental health. So we started, create the language for you, and then you just plug and play. You probably already do something like this, especially towards the end of the year with insurance and things like that. And then the second one is encourage employees to take time off. This I felt like was incredibly important to include. We've seen a wave of organizations that have introduced things like mental health days and wellness days, taking time off, paid time off to attend to your needs. It's not just about personal days anymore. Now you can actually call it for what it is. This is just to help recover from acute stress after a big project, or taking time to spend with your child or whatever the situation may be. And that's from like the employer perspective, saying we offer this time, but people still aren't taking it. And then you listen to workers, and it's often the case of not having too much of a workload to be able to take time off. Or if they do take that time off, coming back and just feeling overwhelmed and stressed all over again because the work didn't go away. So this template is good because you want to encourage people to take time off, but using the right language. So being very direct and having a simple message of like, we offer wellness days because we know after stressful projects, you want to take time off. Here are the different ways that you can do that. Talk to your manager if you need some support with your workload, different things like that. So kind of addressing some of these other issues in addition to just offering that time off. And then finally, we have a small section dedicated to small employers. This came out of so this was inspired by working with a lot of MHA affiliates who do amazing, fantastic work across the country, serving their communities in their state and their regions. and they're relatively small teams. So we've talked to them and had conversations about like, how can we support our workforce in addition to trying to be supportive of the community that we serve. Okay. And then the final piece here, and I have one last question, and then we'll turn it to Holly to kind of start our discussion here. Last piece is workplace support for a healthy life-work blend, work-life balance, life-work balance, whatever you want to call it. I haven't settled on what I like best yet. But this really focuses on two main things. Basically, what additional resources can you offer that help support mental health, but aren't explicitly mental health supports, right? So the first one being flexibility within people or workers' positions. So autonomy, being able to take time off to attend an appointment in the middle of the day and being able to flex those hours. Um, and also just flexibility with their work environment. So, thinking about a hybrid environment, remote work, semi-permanent, all these different options that are now available to us and can really help workers support these competing priorities in life. And then the second one is just different resources that consider social determinants of health. We wanted to take that lens because it kind of broke it down by, and you can also think about this in terms of like the 8 dimensions of wellness, where we focus on financial wellness. So then some organizations offer financial education and planning. Some can help subsidize the cost of transportation to get to and from work when that might be a challenge for folks. One example that we've seen is an organization had an emergency fund for in the event that something tragic happened with a worker's home due to a fire or flood, and that fund was there. So if that were to happen, there'd be some support from the organization. All right. And if there's nothing as in any of that you find helpful, which is perfectly okay, because the only true thing that I've learned in these years of work is knowing how different every industry, size, culture, I mean, across the board, how different these things are from workplace to workplace. So with that, we did compile a couple guides here. We have additional MHA resources. So the screening, mental health month campaigns, our podcast, if you wanted to look into some of those things that are offered. But also we worked with 16 or so partners and collaborators to include their workplace mental health resources. So there's a wide spectrum of services available from consultation, really getting into the nitty-gritty of how to improve these things within your workplace, but also trainings and leadership development and people management. And then finally, we have a list of mental health training resources that we trust. MHA doesn't offer the workplace mental health trainings, but we do have a number of partners that do, including Active Minds, and I'm sure everyone's familiar with national councils of mental health first aid at work. And I think it's important to kind of do your research and look at all the options, because some are 8 hours, some are 1. It's just depending on what people are able to do. So if anything, check out those and that might be helpful in finding what you do need to help support your efforts. Oh, and then my final question to the chat. I haven't been able to see the chat yet. I hope people are engaging with it. I have no idea, but I'll share this last question. But what's one resource that would be helpful to support your efforts in your workplace? Is it more handouts or printable materials? Would it be more guides that just are a list of different resources you can choose from? Let me know what makes the most sense and what would be most helpful to you there. All right. And it would not be a MHA workplace workplace webinar without mentioning Bell Steel. A lot of this information that we pulled together this year was learning from employers who have participated in this program. And I'm super excited to share that Walgreens is now a new recipient for the coming year. So, which is really great news because a lot of the work that they're doing aligns with what we have here. So if you're interested in that, check it out. And I'm going to stop sharing my screen. Oh, Holly's already back on the screen here, and we can kind of jump into our conversation, the part that I'm most excited about. Hi, Holly.
Hi, great to be here. Thank you for having me.
Yeah, thank you so much for taking the time to join us for Walgreens partnership and support. It's really been a pleasure, and you can't say that about every partner. sometimes.
Well, for us as well.
Oh, that's great. Okay, so I have a couple questions for you.
Mm-hmm.
And then, but if anyone in the chat has questions, please drop them because we'll have time for that as well. So first off, I just want to get right into it. It is incredibly validating when a leader takes the initiative and makes this a priority and talks openly about this issue. So, as a leader, why is this workplace mental health important to you? And what brings you here?
So no, at Walgreens, we really strive to foster a workplace environment where our employees, who we refer to as team members, feel supported, respected, celebrated, really, for being their authentic selves. And we have a commitment to providing access to a wide range of tools and resources that they may need. And we've established here, an employee vision, and that is to care for our employees as whole people. So, supporting the well-being of our employees, body, mind, and spirit. And not only that, but that of their family members is really key to realizing that vision. And it's a core component of our brand purpose, which is more joyful lives through better health. And when we talk about overall health and well-being, good mental health is half of the equation. And it's an area that is very important to our team members. And, as part of our commitment to mental health, our investments, they go beyond our team members' time in the workplace. We deliver both professional and personal support. And we know that when we meet the needs of our people, our team is going to be best equipped to meet the needs of our customers and our patients as well.
Yeah, no, that's great to hear. There's a part of me that I wish like young Taylor had heard that from her workplace, and that we care, about your whole person, and having support to juggle the different things in life. And so that's really great to hear. That's what you do with your team members.
Yeah.
And so we did publish a case study with Walgreens,
Mm-hmm.
and that's available as part of the toolkit. And you personally have a rich history of promoting worker mental health and well-being. How would you describe your approach to that, and what's worked to help engage workers in this conversation from a professional or personal experience?
Yeah, so we included a case study, and I'm really excited to talk about the example that we detailed there. And as an organization, Walgreens has offered a wide range of benefits and services before the COVID pandemic. And we recently expanded these offerings through Be Well Connected. That's our mental health and well-being program. We launched it in May during Mental Health Awareness Month. And it's focused on the vision I referenced earlier to support the whole employee, and it's focused on comprehensive health. And what I'd really like to highlight is that it was developed in direct response to feedback from our employees. And it goes to the point, Taylor, you made earlier about when you've met with different employers, how, that there needs to be a unique offering dependent on what their workforce needs, what industry they're in. You've just seen a wide array. And we feel exactly the same way. We need to deliver what our employees need. We have 315,000 employees. We have just about 9,000 stores throughout the US. We have distribution centers, we have support offices. And what was important is meeting that expansive set of needs and meeting the unique and diverse needs of every employee. So the program's made up of a trio of offerings. The first one actually was already in place, which is our Life 365 platform. And that offers digital mental health tools, 24/7 access to professional advisors. And when I say access, that's both in person or virtual. and 5 free visits with a clinician, excuse me, per issue per family member. But then we looked at that and we said, okay, we're going to offer 2 additional offerings together with that. The first is Journey Live. So that is a mental health and wellness platform. It features live classes with expert instructors in which our employees can actually interact within those classes and ask questions. And it's a really wide range of classes that we make available. Topics range from stress management, anxiety reduction, improving work-life balance, getting better sleep. It's a wide variety of topics that we're always adding to. And what's really exciting is that more than half of our US team members and their family members today have downloaded and are using the app now. So that's just from May. So we're really excited about the adoption, that this really is meeting their needs and they're getting excited about it. And then the final offering that make up our trio is Indie Flicks. So this is a documentary film series that features mental health topics such as anxiety, social media addiction, cyberbullying, and harassment. And then each film includes empowering strategies and practical tips. So we're really excited about this new offering. We're getting great feedback from our employees, and it's indicating it's meeting their needs. But as I always say, we're never done. We're always listening, and we're always looking at what can we add, what can we tweak, because the most important thing is making sure we're meeting them where they are.
Yeah, for sure. I really love that you mentioned the fact that it's a trio, and it seems like each service is geared towards a different purpose. So raising awareness and general knowledge about these issues, getting access to direct care. And I think it's I'm just kind of glancing down at the chat of what people have to say. And, the honest truth being that if you only have one resource to turn to, and if it's your employee assistance program or, other type of program, it may not be the best fit. It may not be the best resource for someone. So having multiple options and multiple different ways of approaching this, I think is a really smart, if I do say so myself. So really, I appreciate hearing that. And I think you may have already answered. You probably got ahead of me with my next question here. But we did, no, it's good. I'm sure there's tons we can definitely talk about, but so we did include examples in the toolkit itself of how employers are doing this within their workplaces, including the one that's how did you respond to direct feedback? And I think that's where the trio of those services came in response to that. So I'll ask, is there a single activity or item in the toolkit that you're excited about that Walgreens would, or that you personally would recommend that other workplaces have to check out? I mean, I can go down a laundry list. I'm like, do it all, but love to hear from you and what you think.
Well, I think, the one I'm most excited about, you and I are on the same page, Taylor. I mean, the toolkit, it includes so many great tools and resources, but I believe what's most critical is the cultivation of supportive people managers and a supportive workplace culture. I mean, it goes beyond, whatever, funding you have available at your organization, even if it's just an EAP that you have available, this is really the most critical piece. And I think employers need to understand that this work, it is not and should not exclusively be an HR accountability. This is something that if it's done right, it needs to be championed by leaders, by people managers throughout the organization. And I really believe it starts with creating an environment where your employees feel they can bring their whole selves to work every day. And to do this, managers need to build trust in their teams, and they need to create a safe space where each individual feels comfortable showing up as the unique person they are. And something we did here at Walgreens that I'd like to share is we created something we call the I Am, We Are campaign. And what this is, it encourages our employees to share insights into who they are by drafting 6 attributes that best describe them as a person, along with their photo. And these are auto-generated into a personal social card, and they can choose to share that internally or externally on social channels. And we've seen a bunch of them go online on LinkedIn and other platforms. But just to give you an example of what I mean by this, I'll give you a few of mine. So one is, I am a fierce mother and wife. I am a neurodiversity advocate, and I am a Lego enthusiast. So it runs the gamut. And each card also reaffirms each of our commitment to our purpose as an organization of more joyful lives through better health. And really the philosophy on this is that knowing who I am makes me stronger, but it's our understanding of each other that really makes us stronger as an organization.
Yeah, I love that. I feel like when you talk about, kind of blending the personal and professional and bring your full self to work, sometimes people are like, oh, it could be a frightening thing, or people could be like, oh, that's not going to help me with my job. But what comes out of that, the relationship building, the human aspect of it is so important. And I'm trying to think, I'm like, if I had to build my own, like, I don't know what you call it, profile, or like my own
Your own card,
description.
your personal
Yeah.
card. What would it say?
Yeah. I'm like, it would be, probably just like a fair partner to my, no, I was kidding. Just like a so-so partner, to my fiance. No, I hope I'm kidding.
You're the
It would be
better
like,
half. I'm the better half.
yeah, yeah. Gift wrap enthusiast,
Yes.
and
Okay.
a crafter. I'm like, these are things that I don't even realize I share with my colleagues all the time, because we have that type of culture, and it's a joy learning more about people and what they do and what excites them. And it does helps build that culture. And I feel, and I'm just speaking from my experience, but knowing what that feels like to connect with someone, it does make it easier to reach out to them when you have a question.
Right.
Interactions day to day is
And I'm coming back to you after this, Taylor. I want to know favorite wrapping paper. I want to get some crafting ideas. I'm all about a craft. So we're going to be connecting on that after the fact.
Yeah, no, I will hook you. I'll be like, this is the quality paper, but at this price point.
Okay. I like it.
Second love behind mental health advocacy.
What's the value buy?
Yeah, exactly. So that's all the questions I had for you, but that leaves us some time for audience Q&A, and I hope we have a couple. So I'm going to turn it back to you.
Yeah, absolutely. Thank you everyone for your thoughtful comments, questions, feedback in the chat. I've been trying to keep up as much as I can and pulling some of the questions that you all have shared. First, I know some of these are more general, some are more specific. So Taylor and Holly, whoever wants to take a stab at these, go right ahead. But the first one that we had is, how do you deal with an employer who does not want to address mental health in the workplace? And someone added to that question, how do you deal with coworkers who are contributing to an unhealthy workplace environment?
Yeah, these are great.
It's a loaded question.
Yeah, I know, hard balls right from the start, but these are great questions. Holly, did you want to kick off?
Yeah, sure. I can start with the first one. I think with the first question of how do you, I guess, convince an employer that this is really value add investment, this is important work to do and address. I think the business case is clear, and I would encourage you. I think the resources that MHA are providing, that builds the business case, just in terms of the impact that this really has on the bottom line. When you think of driving a culture of high performance, if you don't have a healthy work environment, if your employees are not able to show up as their best selves every day to deliver the results you need them to, it's not going to work for you. So I think the business case is an incredibly strong one. And I think, for employers, they also have to understand that this doesn't need to mean thousands, hundreds of thousands, millions of dollars of investment. This begins with just coaching and training your managers. It starts there. And if you've got consistency across the board in how your leaders are managing teams, you're going to make enormous impact. So I think it's, make the strong business case. You can start with just that, and the impact will be enormous.
Yeah.
So Taylor, what would you add to that? I'm interested in your perspective.
Yeah, no, absolutely agree. I was just going to share a couple specific resources that you can find them in the toolkit, but if you are trying to build that case from like a numbers perspective, because it's speaking both languages for both business and human, especially if the organizational leadership isn't being receptive to, because it's the right thing to do, which happens in many cases. So we've worked with Shatterproof, National Safety Council, American Psychiatric Association Foundation, a mouthful. They all have some form of a mental illness, mental health cost calculator. So each of them are a little bit different. Some look at substance use, some, each have a different function. But all you do is just input things like the number of people at your organization, the industry, just a couple things that any worker would likely know about them. It's not something that has to be done by HR. And then you can see the exact cost of that in your workplace. And if that isn't compelling enough, because everyone knows the number is 1 trillion globally and 200 billion cost of depression and anxiety in the workplace every year, it's striking. It's amazing what you're losing by not paying attention to this topic. And I mean, same thing goes for if they're not putting in policies in place that are being supportive of people with mental health or substance use issues. The cost in leave and short-term disability and having to hire new staff and not paying attention to return to work and being supportive of those people are huge costs to an organization. So I the mental health, advocate side of me is like just being passionate, sharing your story, being open about this, being a champion workplace. One can create a lot of change and drive that and help start the conversation. But there is the other side of things of like, how can we do this in a strategic way that gets the ear of leadership? And it's challenging. I will say that. I think it's challenging for folks when they want to advocate, but it's definitely worth that effort to push this forward. And I think the other question was about probably more like interpersonal relationships between managers and colleagues that are the big word is toxic these days, right? Having a toxic work environment, having people who aren't receptive to this conversation whatsoever. Something that I tell people, and it's not a be-all end-all solution by any means, but it's really important to be setting the appropriate boundaries with these people, because they can essentially suck the life out of you. It can be incredibly draining. Sometimes that can feel impossible to set those certain boundaries, but it's really important to reinforce those. In addition, I'm a big believer in having direct conversations with whoever might be influencing this and might be affecting your mental health at work or adding to your stress. If that doesn't work, you may need to escalate the situation. And then final part may be having, to switch teams or departments. And, that's not an easy answer. That's much easier said than done. But in situations where people just aren't getting it, you're always going to have a toxic manager. You're always going to have someone in your workplace that's resisting this. But overall, I see us trending in a more positive direction with the way people are talking about this and approaching it. So there's hope. That's not a great answer, but I think we're moving in the right direction with that.
Yeah, thank you both for those really thoughtful answers. I'm going to try and get a couple more questions in. I know there's been lots of questions in the chat about downloading the toolkit. Will this be available afterwards? Absolutely. By the end of the week, we'll be sending out the recording of this session, the slides from today, and we'll include the links in there to download the toolkit if they're not working. I know sometimes when you have your Zoom up and you're following the link outside, it tends to be tricky. So all of that will be in your hands as well. But I have a question here that's more specifically for Holly. When you were talking about some of the new initiatives that Walgreens is providing for their employees with mental health, one of the questions that came up was, how did you get the executive team to align with these initiatives?
Well, I feel very fortunate to work for Roz Brewer, our CEO, who came in pretty recently. It's been here for almost 2 years now. And really to have peers on an executive leadership team that recognized the need for this, that championed the need for this from day one, since I walked in the door 1 year ago. And I think, especially as a healthcare organization, this is something that is held in at the highest level of importance to our leadership. I did not have to create a business case. This was something that was widely acknowledged. And as I said before, we've always had tools and resources in place. What we did with our Be Well Connected program was really just take that to the next level. I had very broad support for this across our executive team and also with our board of directors. So I'm really proud to work for this organization, and really proud of the values that we champion.
Absolutely. Thank you so much for that. I know that some are not as lucky to have an executive team that aligns with that mission, and you've already provided some of those examples of what to do in those scenarios then. And I also think that the toolkit really helps starting the conversation and giving you some concrete language to use when you're presenting this to others and really, advocating for its importance. So we are just so glad to hear that support that Walgreens has shown to its employees. It's put on mental health. So thank you. The next question, I'll give one to you, Taylor. Someone asked, which I think is a perfect question since this is the time of year that you're working on this, but can you tell us a little bit more about how the toolkit and the Bell Seal program are linked? How closely are the Bell Seal criteria linked to recommendations in the toolkit? And maybe just give us a little more information about Bell Seal and what's happening with that right now, as well as Walgreens' recent Bell Seal recognition.
Yeah, this feels like a plant question. Like this wasn't. I'm just kidding. Yeah.
I swear it's real.
I was like, perfect question. Wow, that's yeah. So, well, Bell Seal itself, it's the employer recognition program. It is just like the toolkit, also a pretty comprehensive, lengthy application. We spent several years trying to refine this criteria so that it is accessible and applicable to all different types of industries and organizational sizes. So being attentive to small organizations may not have a lot of resources to dedicate to this, but they're doing really good work. And how are they doing that versus holding maybe large organizations accountable for things that they can afford to do and maybe aren't doing or could do more in that space. So I do think we have a good balance of that, and it is something of weight and meaning, and we put a lot of time in coming from like that worker advocate perspective to craft the criteria. 58 questions, and there's like 10 open-ended responses, just to give you a sense of the format. We just reopened the cycle for this coming year, so if you want to apply for a 2022 to 23 application cycle, you have until March 31st. It's a pretty wide window, and you can start that as soon as today if you wanted to. And you do get your organization's results within 15 business days, regardless of what you don't have to wait until March to get that. So with that, the toolkit so we break the Bell Seal into 4 different categories. We look at workplace culture, benefits, caring beyond compliance, and then like just general wellness programs. Most of the toolkit focuses on the culture and benefits, a little bit of the wellness program side. We didn't include just because it would have been an incredibly overwhelming amount of information, and it already is. But on things like Americans with Disabilities Act, we have criteria in the Bell Seal that looks at FMLA. We have so there's some of that you won't find in the toolkit. It's something that I hope to do in future editions of this, is to expand more on focusing on workers with mental health or substance use conditions and types of leave policy and this and that. So what you'll get as part of the toolkit and how it aligns with the Bell Seal is a lot around people management, a lot about surveying your employees or just measuring your workforce's well-being, whether that's through a survey or a different type of measurement tool, listening sessions and things like that. We ask about trainings that are offered. We ask about the type of benefits that you offer. So I think, if you were to sit down with this toolkit, and I don't think anyone's got the time to go through the whole thing, but if they did and wanted to look at each of these components, everything as part of the toolkit ties back to a criterion Bell Seal. So whether or not you are interested in that program, it does kind of help prepare employers that are aspiring to meet that certification to achieve that. And if not, then I think the toolkit is just a great way to get started and think about those areas that you want to improve on, and reach out to us if you have any other questions about that, and see how we might be able to support that.
Absolutely. The Bell Seal, the more I've worked with you on it, Taylor, and learned about it, it is just such a great program. And I know there's a lot of interest in the chat for it right now. I put the link in the chat where you can learn more about Bell Seal and look to apply. And we can include that in the follow-up materials for you all too. But definitely they are so interconnected, and it's so wonderful that now employees have the resource through this toolkit to really, we have so many questions. How do we do this work? We want to do that, but how do we get there? And what does it really look like? And the toolkit gives you that kind of step-by-step how-to guide to take those first steps, no matter where you are in the process, whether if this is new work that you're just starting to focus on or implement, or if you've been doing it for a while and really are trying to increase, different resources and things for your employees. And that's where those different categories of Bell Seal recognition fall into, that there's always room for improvement and growth that every company can work towards. So thank you, Taylor, for providing that great resource for us all.
Thank you.
Yeah, and we are just getting close to the end of our hour. So before I wrap up, just any other comments, last bits of information, Taylor or Holly, you would like to share with the group?
Well, I just want to thank Jackie, of course, for moderating this session and helping pull this together. And also, Holly, thank you so much for joining us. Really appreciate the time, really appreciate what you shared with us. Super helpful, and looking forward to continue to work together.
Thank you, Taylor. Thank you, Jackie, for having me, and the work that you do, and also your personal stories. Truly inspirational, and I think it's wonderful just seeing all of the individuals that have joined today who want to learn more.
Absolutely. Thank you both. I so appreciate you being here, your work that each of you have put in to provide this resource for everyone. I know everyone in the chat has been super appreciative today, and I want to thank everyone who's joined us for your engaging comments. I have loved reading throughout today in our chat, and just for being such a wonderful audience as usual. We appreciate all of you and the work that you're all doing out there to make your workplaces a healthier, more supportive environment for mental health. And just by being here and wanting to learn and listen shows that you're taking those first steps. So thank you all. Just a reminder that we'll be sending out these resources within the week. And if you have any other questions, you can always send us an email at our webinars@mhanational.org. But thank you all for joining, and you will be receiving these follow-up materials from us soon. Thank you, Taylor and Holly. Have a great day.